Electronic Visit Verification, EVV, Guidance and Training. WNYIL Taking Control Training for Personal Assistants, PAs. September 2022. What is Electronic Visit Verification, EVV? It is a data collection system requiring the use of compliant technologies in order to record services provided to our consumers of the CDPAS program. For WNYIL, the data collection system that is compliant would be the use of the consumer's telephone for you to clock in and clock out, utilizing a unique identifying PIN number. The data collected from this transaction is recorded by CareTime. What is Electronic Visit Verification, EVV? What does all this mean? It means when you clock in and clock out using the consumer's phone, the data collected from that transaction is stored in CareTime. CareTime tracks this information and then creates data reports to send to Medicaid so that New York State can ensure that services that are billed to and paid by Medicaid have actually been provided by the individual PA to the consumer based on the consumer authorization and care plans. What is Electronic Visit Verification, EVV? Additionally, the use of an EVV enables WNYIL to ensure timely service delivery for consumers, include real-time service reporting and monitoring of all PA's clock-ins and clock-outs, safeguard that consumers who are authorized to receive services are getting the expected care per their authorizations and care plans. Why do we have to implement an Electronic Visit Verification, or EVV system? The 21st Century Cures Act. 21st Century Cures Act. The 21st Century Cures Act is a federal law passed by Congress December 13, 2016, mandating that states receiving federal Medicaid dollars must implement Electronic Visit Verification, EVV, for all Medicaid-funded personal care services, PCS, and home health care services, HHCS, that require an in-home visit by a provider or staff. The mandated New York State implementation date for EVV use for our CDPAS program was January 1, 2021. New York State selected the choice model, which allows individual providers to select the EVV system that will work best for them. 21st Century Cures Act. The Cures Act requires that the EVV system capture the following 6 data points: service type, individual receiving the service, date of service, location of service delivery, individual providing the services, begin and end times of service. WNYIL has chosen to continue to use CareTime as our EVV service provider of choice for the agency to ensure continued compliance with the requirements set forth by the 21st Century Cures Act. System Overview, Workflow, Data Collection. System Overview, Workflow, Data Collection. WNYIL has chosen to utilize the Electronic Visit Verification Data System, CareTime. All PA's recording time spent working for consumers enrolled in the Taking Control program are required to use CareTime for all clock-ins and clock-outs. PAs will do so by using the consumer's telephone to dial the 1-800 number for CareTime to clock in at the start of their shift, and then again to clock out at the end of their shift, using their personal PIN number assigned by our Taking Control department. This PIN number will only be assigned to the PA after the PA has been successfully onboarded by our Taking Control staff and the consumer has received all authorizations into the program for the provision of services. Manual documentation of EVV data. EVV data manually and what to document. Occasionally, there may be a situation where the PA is not able to use the consumer's telephone to clock in and clock out, or the CareTime system is temporarily unavailable. In that type of situation, the consumer must contact the Taking Control customer service team with details of the PA's shift, including the date and times of the shift, so it can be manually entered into CareTime by our Taking Control staff. The Taking Control staff will document in the Electronic Consumer Record, ECR, Welligent, the information provided by the consumer as they then manually enter the shift in CareTime. How to electronically collect EVV data when there are multiple caregivers. How to electronically collect EVV data when there are multiple PAs working. Each PA will be required to clock into the EVV system using the consumer's telephone, and upon dialing in will enter their PIN number. This combination of the consumer's telephone number and the PA's PIN number will record date and times of the shift for that particular PA to be recorded in the EVV system as providing services for that particular consumer. How to electronically collect EVV data when there are multiple PAs working. Should another PA be working at the same time for another consumer within the same household, that PA would follow the same practice of clocking in and clocking out for their consumer, so they are properly identified for the date and time of their shift as well. How to electronically collect EVV data when there are multiple consumers. How to electronically collect EVV data when there are multiple consumers in the home and one PA. When there are multiple consumers in the home assigned to one PA, the PA will follow the automated prompts to choose their assigned consumer and will clock in and clock out as standard practice for each consumer on the correct dates and times of their shifts. How the EVV collects the data. How the EVV collects the data. Data collected from PAs clocking in and clocking out from the consumer's telephone will be automatically stored in CareTime. Data collected by CareTime will be sent monthly to WNYIL, the system that allows New York Medicaid providers to submit claims and receive payments for Medicaid-covered services provided to eligible members. Monthly data will be submitted by the WNYIL accounting team to the WNYIL EVV portal. What information must be shared with the consumers and their families about EVV? What information must be shared with the consumers and their families about EVV? PAs should discuss the NYSDOH electronic visit verification fact sheet that the consumer received at their intake from their administrator. Should the consumers and/or their families have any questions, they can call our Taking Control customer service phone number at 1-800-348-8399 and speak to one of our WNYIL Taking Control staff for assistance. Consumers and their families will be able to access the resources on the Internet that are provided in this PowerPoint. Consumers and their families will also have access to the fact sheets, PowerPoints, and other guidance material on WNYIL's Taking Control Agency website, www.takingcontrolny.org. What information must be shared with the consumers and their families about EVV? For further information or questions, please contact WNYIL Taking Control Customer Service 1-800-348-8399. The required resources listed within this PowerPoint, the NYSDOH fact sheets. Required resources. Resources. The New York State Department of Health maintains resources for individuals and entities to find or receive information on the state EVV program. The following resources were either used or quoted in the creation of this training, and as required by New York State Department of Health, NYSDOH, are being credited for their content used, copied, or referred to within the training. They are also required references for users of the Electronic Visit Verification System, EVV, per NYSDOH requirements. Resources. The following 6 fact sheets are all found at different Internet URLs that begin the same. https://www.health.ny.gov/health_care/medicaid/redesign/EVV. Number 1, index.htm. Number 2, FAQs.htm. Number 3, tech_assist/index.htm. Number 4, repository/EVV_prog_guidelines.htm. Number 5, repository / considerations _ select _ VVV _ sys.htm. Number 6, beneficiaries / index.htm.